What kind of harvesting approach would you recommend? Also, how many grafts, follicles, cost for good quality? I'm 31 years old. I've been using Rogaine foam for about 5 years. I only use it once a day. Post-recovery, I would like to be able to style my hair short, pictured, or longer, about 1.5 inches at times. I would like my hairline fully restored and the top of my scalp were thinner, not visible.
Thank you for your question. You're 31 years old and you've submitted a photo on the top of your head and your description of your donor area, and you want to naturally have more hair, and you define the areas that you want to fill. So the questions that you're asking have to do with transplantation. And I'm going to caution you a little bit about the issues with transplantation when you're as young as you are. You see, at 31, you have a relatively advanced stage of hair loss. Understand that transplantation is from a very limited area of donor. So you have to not think about where you are now, but if you look at the most advanced male pattern hair loss, you'll realize that there's a very narrow band where the hairs can be transplanted from. In fact, from my perspective, there's been a very disturbing trend with the current popularity of a procedure called follicular unit extractions, or FUEs, where hairs are being harvested well outside of the well-established donor area that is known to be permanent. And that is mostly because people have become very concerned about the undesirable scars related to traditional strip surgery. Now, ironically, it's called traditional strip surgery, even though prior to the strip, the grafts were basically just slightly larger follicular unit extractions. So it's kind of like there's a cycle of this procedure, but in the end, we have to be clear. There's a limited area of donor. Now, the way you wear your hair so short, it makes it also a challenge, because whether you do a strip method or an FUE method, it is likely your scars will be visible. So I'll tell you a little bit about how we approach someone like yourself in our practice. We have been in a leadership position with a new concept we call hair regeneration. What we have done is combine a material called platelet-rich plasma with a material called extracellular matrix derived from pig bladder, originally intended for wound healing. Now, why am I discussing this? Well, think about where you are at 31 and how advanced your hair loss is. Now think about where it will go in 5 years, 10 years. You don't have a never-ending resource in your donor area. And even if you decide to do follicular unit extractions once, if you do it again, those areas that were, quote, limited scars are going to start to coalesce, and you'll have a lot more. So you may find yourself in a very difficult situation, and we have patients who come from all over the world who are in exactly that situation. So what would have been an alternative for a lot of our patients 10 years ago would have been taking a drug like finasteride. Unfortunately, in the most recent few years, a lot of younger males will not take finasteride. They go on the internet and they see anything about sexual side effects, and there's just no way they're taking finasteride. In addition, a lot of younger males who are losing hair tend not to respond as well as men who are in their 40s who have like a crown thinning pattern. So hair regeneration has been our solution towards reversing the thinning hair. when you look at the scalp, and what we do is we do a microscopic examination, and we're able to identify that although an area may look smooth or without hair, there are a lot of miniaturized hairs. Hair just doesn't disappear. It goes through a process called miniaturization. We've developed a way of doing this injection treatment, and right now we're doing it once. And we have 3 to 5 years of data to support the long-term benefit that once we do the injection, we appear to have created a wound healing mechanism that restores the stem cell activity necessary for hair growth. So what we end up doing for most of our patients these days, especially someone as young as yourself, is we recommend first doing the hair regeneration treatment. Restore as much of your thinning hair, reduce or halt the progression of the hair loss, and then if we want to improve the areas which are too far gone from the advancement of the hair loss process, then we can do a much more conservative and strategic transplant. This is a very different approach than the traditional model of transplantation. Someone like yourself would have been committed to having to go back every few years until you've run out of donor area to transplant the hairs. And a lot of people, particularly those who like to wear their hair short, eventually, because they run out of transplanted hair to transplant, they'll actually just shave their head. And now they're dealing with the problems with the marks left from transplantation. So I would advise you to really do your research before you move forward with a transplantation and learn more about hair regeneration. And I think that you will have at least the information you need to make a decision. Unfortunately, hair transplants are sold very aggressively, and a lot of people don't realize what kind of commitment it is until it's too late. So the best option for you first is to learn more and more, and then meet with doctors and learn about the options and what the future will be if you were to move forward with a transplantation, and be strategic in how you do what you ultimately decide to do. So I wish you the best of luck. I hope that was helpful, and thank you for your question.